Good day, everyone. My name is Clarissa. Our topic for today is care of patient with restraints. Now, our objective for this topic is for us to define what is restraint, its purposes, the types, and be able to explain and interpret our policies on restraint, identify our nursing responsibilities, what to monitor when patient is for restraint, be able to assess and document them. Again, at the end of this presentation, a short quiz will be provided as part of your participation. Okay, now let's move on to the definition of terms. Restraint is defined as a manual method of restricting a person's freedom of movement, physical activity, or normal access to his or her body. This is for non-violent as well as for violent client. Second, we have seclusion. This is an involuntary confinement in a room or area where the person is physically prevented from leaving. This is also for violent and self-destructive behavior. Third one is a chemical restraint. It is a drug or a medication is used as a restriction to manage the patient's behavior or to restrict freedom of movement. Okay, presented in this slide, we have physical restraint. Examples, we have the wrist and ankle restraint or the extremity restraint. We also have mitten as well as the waist restraint. Now let's move on to medical restraints. It manages the nonviolent, non-self-destructive behavior. It ensures safety by preventing self-harm and ensuring compliance with essential medical treatment. It also stops patients from causing further injury to themselves or on others in emergency situation. And finally, it restricts a patient's movement during a medical procedure. Okay, now let's move on to our policy on care of patients with restraints. Now, the purpose of this policy is to ensure patient safety and security while respecting his or her rights and dignity and ensuring the well-being in relation to the use of restraint, and to limit the movement of confused, disoriented, and combative patients for protection from injuring themselves or others, and to facilitate examination and to aid in diagnostic tests and treatment. Okay, now let's move on to the definition of terms. According to our policy, restraints is defined as an intervention that prevents a person from behaving in ways that threaten to cause harm to himself, herself, to others, or to property. Now, physical restraint is defined as a manual method, a physical or mechanical device, material or equipment that immobilizes or reduces the ability of a person to move his extremity or body freely. While chemical restraint is the administration of drug or medication wherein they have to manage the patient's violent and aggressive behavior. Okay, now let's move on to the policy of restraint. Now, the use of restraint involves weighing the benefit of using restraint against the risk of not using restraint. Now, the application and management of restraint will vary according to the needs of the person to be restrained. Now, assessment to determine the need for restraint will be comprehensive and performed on an individual patient basis. So whether the patient is agitated, is the patient disoriented, or the patient was admitted for any pathological with psychological disorder that might provocate harm to himself or others. Now, intervention will be tailored to promote patient safety and quality of life. Now, every effort should be made to use skills and techniques that do not use deliberate application of pain. Now, we have to remember this one or focus on this. Wait. Okay, the validity of treating physician's order expires after 24 hours. If restraint remains necessary, the order must be renewed. In the absence of renewed order, restraint shall be removed by the staff nurse. Now, the most responsible physician performs periodic assessment and reassessment. The patient's condition should be monitored hourly and documented during the period that he is restrained. The patient's dignity and rights must be protected. The patient should be kept covered when attending to his or physician needs. Restraint should be used only when necessary. Restraint should be applied correctly and appropriately. And finally, restraint should be applied in such a way as to allow immediate release in case of emergency. Continue. Restraint should be applied in a manner that maintains proper body alignment and ensures comfort. Staff nurse is permitted to apply, release, and reapply restraint. The reason for using restraint should be explained to the patient and family to prevent misinterpretation and ensure cooperation. Any restraint that requires attachment to the bed should be secured to the bed spring or frame, never the mattress or the side rails. Use of restraint must be appropriate and safe for patient and staff. Use as a last resort and in conformance with applicable laws and regulation. Appropriate interventions are performed when the patient's circulation is being impaired. Appropriate interventions are performed for side effects related to major tranquilizers, and staff members involved in restraints are trained and competent. Now moving on to the procedure of restraint, we have to determine the most suitable method of restraint. We have to consider the least restrictive measures first. Apply restraint so as to cause minimal distress to the patient. The nurse should verify that there is a written order which defines the reason for restraint, the duration for the restraint, and the types of restraint to be used. Okay, now moving on to the next slide. Nurses, focus on this one. Emergency use of restraint may be initiated prior to a written order when the staff nurse determines that there is a need for restraint. Now, the nurses should monitor the following hourly. We have the position, circulation, skin integrity of the restrained area, maintenance of patient's privacy, comfort and room temperature, appropriate application of the device, needs of the patient, ROM, and we have to evaluate restraint reduction or removal. Now, the staff nurse should maintain and always protect the patient's rights and dignity. Okay, then the patient and the patient's family shall be given an explanation by the staff members regarding the use of restraint, which include the purpose and application of restraint, the alternative to the use of restraint, the criteria for release of restraints, and the plan of care of the patient. Okay, now let's move on to the measures to protect patients' rights. So restraint will be based on the patient's assessed needs. Patient or family will be informed of the reason for the restraint. Patient and family will be informed of the behavior that will allow for safe removal of the restraint. Alternatives to restraint will be discussed with the patient and or with the family. And the nurse will document patient and family education in the system. Okay, now in summary, the use of restraint only when essential to protect patient from harming themselves or others, and when all other interventions have been unsuccessful. Now, the goal of Majarda General Hospital is to protect the patient's health, safety, and preserve the patient's dignity, rights, and well-being.